an important subject, as we said, but one that is sobering. Now, we like to turn to Dr. Teddy Totimeh because he always claims he has no specialist knowledge of the area, and so he's going to give way to people who know much, much better than he does. But Dr. Totimeh, just to set it in context before we turn to the two ladies. So cervical cancer, one of the leading causes of cancer deaths amongst women. Apparently no very detailed research information for Ghana, but certainly the incidence in West Africa remaining high compared to parts of the world that I believe we've mentioned in previous discussions. Ghana, one of the leading countries believed to have an incidence of something like 18.3 women per 100,000 based on regional sampling. Any evidence to suggest that this is a worsening picture, or do you see grounds for hope with the incidence of cervical cancer?
Well, thank you. This being the Cervical Cancer Month, I thought that it was really important for us to look at it from various aspects. And I'm really blessed to be in the presence of these people because, they're sorting out the science of cervical cancer when it comes to looking at what's happening at the molecular level and things like that. They're from this fantastic place called Yemaachi, and they'll tell you more of what they do, but I thought it would be really good for them to start the discussion. The truth is, 50% of Ghana is still under 18, right? And all the seeds that are sown for cervical cancer are sown in young people. And it's really important that, Ghana is taking this whole concept of, vaccination seriously. And I know those are some of the things that are happening this year that we're having to think about. I mean, on the neurosurgical side, we're interested in tumors from everywhere because any tumor can go to the brain and then we're in trouble. So, but definitely, are things worsening? Well, I think that the fact that we're thinking about vaccination, we're thinking about early, detection and all that is refreshing. However, until the pap smear is covered by health insurance, we're not exactly doing anything, right? There's a very important instrument called the colposcope that is used to look down and do, various. If we could tell you the number of colposcopes there are in the country for the number of women that we have, you would know that there's a problem. So I think I'll give the answer on two sides. I'm encouraged by the fact that we're looking at early detection, thinking about it more seriously as a country, that we're looking at vaccination and thinking about it more seriously as a country. But we must put where our mouth is and invest where we think, because it's a disease of the young and it has implications on the future.
Indeed. And turning to perhaps Dr. Olive Tima Danso first, Dr. Dogood, and we know that you're doing good as a women's health specialist. Yes, Dr. Teddy Totimeh referred there to, yes, there may be signs of progress, but we could be doing so much more. Suggestion that in 2022, there were 2,797 women who were diagnosed, 2023 rather, 2,797 women who were diagnosed with cervical cancer, of whom just under half died from the disease, which seems good compared to the previous year where there was something in the order, a greater number, and certainly more than 50% were dying from the disease. I believe 3,072 and 1,815 dying from it. Do you find in your daily practice that there is at least more awareness of the risk of cervical cancer now it is such a leading cause of illness and mortality?
Yeah, in my practice I have come to realize that there is an increase in awareness amongst older people,
right,
and not the younger people as much. What I have noticed is that there has been an increase in teenage pregnancy, and I'll have to relate it to cervical cancer because cervical cancer is caused by HPV virus, and HPV virus is sexually transmitted. And it being sexually transmitted, that means if you're having unprotected sex, that means you're exposed to the virus.
The HPV being the human papilloma virus, and apparently there are more than 100 varieties of this overall, 40 of which affect the genital region, but there are two types in particular, 16 and 18, which seem to be primarily the causes of cervical cancer.
Yes, 16 and 18, there are also others, like 31, 33, 35, that's 41, that's 45, 51, and 58. But 16 and 18, yes, primarily are the main dangerous ones that can cause cervical cancer. In relation to teenage pregnancy, having unprotected sex puts you at risk. That means if there's an increase in teenage pregnancy, it means that there's an increase in unprotected sex because they are getting pregnant. That means there's an increase in exposure to cervical HPV virus.
But when you're talking about young girls protecting themselves, are you talking about, are you suggesting that the best way of protecting themselves is through barrier methods, or is any kind of contraception that they'll be taking, if they're saying taking a pill or something, would that also protect them from HPV?
Barrier methods protect you from HPV.
So condoms.
Yeah, condoms. But it's not also 100% because the virus is still exposed to the you can contract the virus around the scrotum and the sexual area too, because the epithelium is present. So even though condoms do protect you, it's still better to screen at an early age because you can still get the virus even with the condom, even though condoms do protect you.
And then there's vaccination, mentioned earlier on by Dr. Totimeh.
Yeah.
How is that done? At what sort of age do you think even adolescents should be thinking of getting vaccinated?
Yeah, so in other countries, vaccinations are being given to people from 9 years and above because they haven't been exposed. Usually they haven't had any sexual intercourse, but that has not been brought up in Ghana yet. You have access to the vaccine if you pay for it in this country.
Yeah, Dr. Totimeh mentioned it's not yet available under the National Health Insurance Scheme.
Yes. So the incidence is lower in other countries, much, much lower, almost non-existent in some countries that are vaccinating people at younger ages. But in our country, we have to screen and vaccinate.
So yes, there is the question of what you do to try to prevent getting the disease in the first place, and also the question of treatment, what you do if you do discover that you have the disease, and Dr. Totimeh mentioned pap smears as well, being a matter that perhaps the National Health Insurance Scheme might want to turn its attention to. Dr. Aida Manu, now you work at the high-tech end of things. Yemaachi Biotech, I mean, I always thought it was a Japanese company when I saw the name, but no, based right here in Ghana, and doing some high-grade, high-level research into creating what is described as a cancer biodatabase to inform decision-making about what cancer drugs and treatments we use in the future. In relation to cervical cancer in particular, how are you approaching the business of presumably going around gathering the information, doing the surveys to create this biodatabase?
So Yemaachi Biotech, simply put, it's not Japanese, so I think Dr. Totimeh pronounced it correctly, where it's more like Yemaachi. It's a combination of a few Ghanaian languages. But
what does that mean? What combination?
So Yemaachi, so Yem means knowledge. Amachi means health. medicine, and then Mache is, good morning. So altogether, the meaning is a new dawn for healthcare in Africa.
I see.
So simply put, what we're trying to do is reduce the economic burden of cancers in general on our continent, because we have we face the highest burden of cancer globally. We also have a very diverse genomic data set. Our genomes are very diverse, so information that could be learned from us would not only lead to medications and diagnostics that work for African people, but it would also work very well for people everywhere, because as they say, most people originated from Africa. So I'm not a medical doctor.
Oh, aren't you?
No. No.
For me.
Yes. So what Dr. Totimeh also mentioned is that we're trying to tackle cervical cancer from all angles. So we partner with Dr. Dogood to provide the medical care while we focus on the scientific research at the molecular level. So we also have a small diagnostic arm, which is where our Sheba test comes in. So Sheba tests for the DNA of the human papilloma virus, specifically those ones that have been noted to be high risk or medium risk for contracting cervical cancer. So once we do that, we have also provided it in a convenient way. So instead of women having to go to the clinics or go to the hospital to get a pap smear to screen for cervical cancer, you can purchase a sample collection box, collect the sample yourself, and then send that in. And at our lab, we then perform the molecular diagnostic testing on those samples and then let you know what kind of HPV variants, if any, are found in your sample.
So you work as a regular diagnostic service for people just essentially wanting to know their status, but you also have this long-term research interest in gathering larger data sets to inform our knowledge about the way the disease is working in this country. Presumably, you're privately funded and privately organized. I wanted to know, for people, for example, looking at people who have already contracted the disease, do you get cases referred to you by doctors working within the health system, public or private, or is it a case of largely relying on the people who come to you seeking diagnostic services, or people your researchers and surveyors identify and go out and seek samples from?
So we are primarily a research company focused on cancer genomics. So we don't see patients ourselves. However, we work with many institutions, not just in Ghana, but in Nigeria, in Kenya, and a few other African countries. So we create research projects in partnerships with clinicians and oncologists, some surgeons in these hospitals. So they see the cancer patients, and if their patients agree to be in a research study, we collect some of their samples where it's analyzed in our laboratory right here in Ghana. So the samples are not leaving. The data is protected. We are very vested in returning benefits to the communities that are providing the data for this sort of research. And then as part of our research, we also have the technology to do some simple diagnostics relatively that would go into, creating a lot of impact in reducing some incidence of cervical cancer. So unlike some of the other cancers, we don't necessarily know how to prevent it. With cervical cancer, you just have to get screened. There's a virus that can cause 99% of all cervical cancer cases. So if you screen for the virus and now you keep an eye on it, you get a colposcopy or you get some other way of looking at the cells themselves, you can prevent anything that is found there from advancing on to cervical cancer, which would be more difficult to treat, which is why there's a high incidence of cervical cancer deaths. Because we're not screening and women are presenting too late.
Now, Dr. Olive Tima Danso, sorry, I wanted to ask you in relation to this, and you touched on it in your submission earlier on with the problem about adolescence, because this is again a disease that is it should be of concern to younger women, given its incidence amongst people aged 15 to 44. But the difficulty, particularly in dealing with adolescents, as all matters gynecological and to do with our nether regions, and particularly dealing with women, guardians and parents having to make this very tricky decision of, okay, so it's in the interests of, say, your child or your ward's health to start getting them screened early enough in their adolescence, but not wanting to expose them to that kind of thing at an early stage. And of course, this is unlike breast cancer, which can affect men. Cervical cancer can only affect women. It's a female disease. Are you finding greater openness, perhaps, amongst people who come to consult you? How do you work with, for instance, education systems to actually increase awareness of the importance of this and getting people to overcome maybe some cultural barriers to being more involved in self-protection measures?
Okay, so with Dr. Dogood, what we do, mostly our target is university students, and I am into sexual health, so I talk to university students about any sexual health problems, and in that case I'm able to insert some form of education here and there about cervical cancer awareness. So I do that. With the parents I have seen, it's difficult to talk to them about their young adolescents coming up, that they should be aware of cervical cancer, and start talking to them about even exposure to sexual intercourse. It's very difficult, so it's not a subject we touch on, but if adolescents do contact me, it's easy because we can form the rapport and then we can talk about it. And that's what we do with Dr. Dogood. We get to talk to them because it's mostly virtual, and you get to talk to them and it's confidential. We keep it between us, and we're like friends, so we talk about it. It's very...
Now, in some other countries, I remember visiting Denmark on one occasion and talking about contraceptive advice and family planning, and they have a culture of sharing sex education peer-to-peer, so you don't get the grown-ups talking down at you. It's people of their own age, young people's own age, who are trained. They become trainers of trainers even, but they are the people who communicate that information. Are there any such ventures here in Ghana, or is it again a bit of a bridge we've yet to cross?
That's a bridge we yet to cross, but I think we should be open-minded about that and start incorporating that in our educational system. Maybe we should get seniors in secondary school trained to maybe teach the first year, second year, and there should always be like someone elected to be in charge of such things, STIs, and then cervical cancer awareness. I think we should start approaching that as well.
Aida Manu, talking about Yemaachi and the work that you do there, because of course it's the research into the disease, but as you said, looking to devise regimes that are appropriate to the kinds of cancer incidents that we have in a country like Ghana, and particularly to do with cervical cancer. There is, of course, concern, particularly in the wake of COVID and what we experienced there, suddenly discovering that you're at the mercy of supply chains over which you have absolutely no control, and that indeed some of the medications that may be bowled at you are completely inappropriate for your needs. Always the question mark over Big Pharma. To what extent are the drug regimes that you might be looking to tap into also African originated, homegrown, and therefore appropriate to the particular genomic evidence that your research is unearthing?
Okay. So in Africa, we're still very early when it comes to drug development. I don't know that I don't know of any other any companies that are really actually developing drugs in Africa for cancer.
However, not even in Southern Africa.
I would have to look and get back to you. But in our part of Africa,
West Africa.
In West Africa, we're not. Africa is also very diverse, so you can't really say that what you would find in East Africa would apply to those from West Africa. So we are taking the approach of sort of being the company that would aggregate data from all over Africa. We're working in South Africa yet, but we're not collecting samples. So so far it's North Africa, East Africa, West Africa. And our part now is to collect that data that would form the beginning of the drug discovery pipeline, because you have to start from somewhere. So right now, less than 4% of all genomic data used in research is from Africa. So our data is not being used to develop drugs.
Even though we have the most diverse
highest
genomic database. Fantastic.
Exactly.
Great.
Yes. For cervical cancer, specifically, since we're highlighting it this month, for Yemaachi, the advantage of being a research company that is doing some diagnostics is we have a bit of interest in, why are we seeing certain things in the lab? What does it mean? So Dr. Olive mentioned a lot of HPV variants that are known to cause cervical cancer, and these are studied globally. In our lab, we're seeing one that is coming up as prevalent, which is HPV 39. And as far as I know, it's not on any of the vaccines that are being given. So this is the advantage of doing some of this research locally, because you get to see the things that are actually affecting us. And then you can start looking towards, should we start working with people who are developing vaccines to create vaccines for the actual strains that are being seen in here? Or, these things can also guide policy. Get our government to support, at the very least, pap smears, ideally HPV testing, certainly vaccinations, and not just for teenagers like we're starting to do, but even earlier, because
younger
boys and girls are being exposed to these viruses through earlier sexual activity. So they're starting as young as 9 years old in other countries. So we should be looking to do that. We should definitely be doing the research ourselves, because it's in our interest to get this information that works for us.
Indeed. African solutions to African problems.
Exactly.
And a note of hope there from Dr. Aida Manu, Director of Operations at Yemaachi Biotech. And we're also joined by Olive Tima Danso, Women's Health Specialist, Doctor with the Dr. Dogood project. Feel Good project. It's been a very feel good discussion. And Dr. Teddy Totimeh, Consultant Neurosurgeon on Health Today, talking about cervical cancer and what we're doing. Very encouraging meeting, three bright sparks, proving that there's actually things being done out there to improve our health. And that, I'm afraid, is it for the ABS this morning. Thanks to all our listeners for joining us. Our apologies to people who may have had problems with connectivity. I think there's something happening with internet service providers, but we hope you've been able to listen to us even in the most old-fashioned ways. Stay tuned to Asaase 99.5, where coming up on our main programming next will be Asaase Cafe and the Bangers, courtesy of those DJs. They like to make noise and just get people, jumping up and down. But coming up next, the news update from the Elizabeth Ikea Ohina newsroom with Elizabeth Yeboah. Whatever you do today, Thursday, have a fantastic day, and thanks for joining us.